Yes.
We're going to be talking about policies and procedures today. I believe Sam's making this mandatory? Okay, so policies and procedures, pretty cut and dry. You guys know wherever you work, there's always policies to follow and a procedure. So at VNA, we're going to really kind of target this tonight about the employee handbook because we're having a lot of problems. And we really have to talk about things so we can try to straighten them up to get everybody back on the same page, because it's like we orient, and some of you been here longer than me, but we orient and it seems like soon as you leave the front door, out it goes somewhere deep into the community and it does not come back. Alright, so I'm going to specifically talk about cell phone use tonight and Carewatch, and requesting off and calling out, because those are the big problems for me I'm facing, and I think Claudia's had some bumps in the road the last couple of months. So again, VNA, when you're hired, we let you know for a home care aide what you're expected to do, obviously, and if anything goes wrong, how you're supposed to handle that situation. So let's say you're running late. You are to call the office, unless it's over the weekend, then you call the on-call number and you let them know so then they can tell the family or the patient. But a lot of you guys have given your cell phone numbers to patients and you go ahead and you call them yourselves, which sometimes can cause a lot of problems. So you kind of want to just get back onto that, letting us handle that. Because once you give a client your cell phone number, forget it. Alright, so another policy that's been a little rusty are like falls. When a client falls, please make sure. Oh, you're not? I just got the alert. I'm sorry.
Yeah, I couldn't see
Can
anything.
you hear me now?
I can hear you.
Okay, good. Sorry.
That's okay.
Modern technology glitches. So what was I saying? I forget.
Fall.
Falls, okay. So if you have a client that falls, please don't wait a week to tell us. That has to be reported immediately. Because especially if they have to go to the hospital, again, that's a policy. If they fall, the procedure is you don't help them up. They either get themselves up or you have to call 911. And then the procedure afterwards, you have to let us know right away, especially if there's a hospitalization or there is a injury. So there's been times where we don't hear about these falls until days later. It's, so I want to really talk about your role as home care aides, and then we'll talk about the other stuff I said we're going to mention. So everybody has this handout. This is right out of your folder that you get for VNA. Sorry ladies, I know you guys don't have this, but you should have it. It's part of your employee handbook. If you still have it, you can go back in and it's addressed that says home care aide at the top.
Okay.
So when you guys are hired here, this is a non-skilled agency. So basically in the nutshell, we take care of clients who don't need a ton of care at home. If any of you guys have worked in facilities or skilled agencies, those clients are obviously a little bit more to do. They have a lot more going on. So the home care aide is a paraprofessional who, under a client-specific plan of care, every client gets a plan of care, and a homemaker support service on an intermittent long-term care basis for the sick, frail, and or disabled individual to support a safe and healthy home environment. So we are here so people can stay in their homes safely. Obviously there's some that have no business at home, but it is what it is. So we try to accommodate their needs as best as we can. The home care aide works for the VNA under the professional supervision of a registered nurse, which is Claudia and I. We are the ones that go out and do the assessment of the home before you guys go out, and we make sure everything is up to snuff so we can make a care plan and give you guys the care plan, and then you can go out and do your thing. The duties of the home care aide are planned, assigned, and supervised by the nurse to meet client, patient, and family situation. The home care aide is qualified to provide care to patients participating in the Medicare home health or Medicare hospice benefits. See, that's where it needs to change. But you guys get the picture. So you're hired so you can maintain the client's environment at home as best you can, because sometimes they're forgetful, they're not able to do their own laundry, they're not able to run to the store, they're not able to do certain things like they used to. So I think you guys all know that. So we have patients on the options program, which limits them to 6 hours a week, and we have patients on waivers, so they can go up to 24 hours. We don't have 24-hour cases here, but other places I've worked, there's lots of them that had around-the-clock care, and of course there's private pay patients where they're paying out of their own pocket for their services. Now sometimes with the options program, they do have a small copay that they have to pay monthly for their services, so just make sure you know that. Alright, so whenever you're hired, Sam likes you guys to go on and take a home care aide test. I think he sends you that information through the PA website. You go on and you take that test, but some of you don't have to because you're certified nursing assistants that you got your credentials through the state. And then you come in, you do your TB, you do your interview, you get your flu shots, you turn in a bunch of paperwork, so that's part of our policies. There's certain paperwork that you have to have filled out before you come on board with us, and there's no way around it, with the exception of, just some minor stuff. But most of you guys have to have two-step PPDs when you come here. You have to have evidence of a physical, your testing, driver's license, registration. I know there's some of you guys that don't drive. But now I think as things have changed, Sam is really trying to get more drivers in. But if you don't drive, we don't discriminate. It is what it is. Not everybody has a car. Not everybody can drive. So we are very understanding to that. So let's really kind of talk about, I'll talk first about the schedules. Once you get hired, we give you a paper, well I think before we give you a paper, and you write down what your preferences are. And lately it's been, as soon as the preferences are written down, then we give you a schedule, then the preferences have changed. Well, I can't do that. Okay, but you told us that. You told us you're available from 9 to 5, but now you're only available from 9 to 1. So that gets to be very frustrating to the schedulers, especially if they specifically have a case set up for you. That's been happening a lot lately. So whenever you have a change in your own personal schedule, you have to communicate that with the schedulers immediately. Please don't wait, once you get your schedule, then you can't work. So that's, So you have to give them your schedule and what you're available to do. The same thing with requests off. You're supposed to, according to this paper, submit a written request in a timely fashion. And the word timely is different from person to person. Some people think a request off the day before they want to take off is okay. No, it's not, especially if the schedules are done a week in advance. It's very unfair to the client that you're taking off the day before and we might not have coverage for them. You have to put yourselves in their shoes. So if you want to request off, most of us know ahead of time, doctor's appointments, children's activities, grandkids activities, weddings, funerals are a little different, but most people know when they need to take off. So if you know something is coming up, please give them ample notice.
Sometimes you don't.
We know things come up, but I'm talking about some people are constantly the last minute, folks. It's literally every other week, well I can't work this, I can't work that, but this is the availability you gave us upon hire. So if that has changed, you have to communicate that to us. I don't know if you want to add anything, Claudia, to that.
I do, just a little something.
Okay.
Because recently, 2 on my team have had some serious concerns that needed eye treatment.
Right.
And I know myself, I don't tell specialists when I can see them, they tell me
Right,
when they get
correct.
there. And most of the time, I'm routine.
Mhm.
So I know 6 months from now, I know better when to make it. But those kind of situations, I think that if the team member would email you and me, so that we were also aware, this wasn't the routine, this is what usually happens, but there are certain circumstances. And maybe even like if Sam wanted, that the doctor would write a brief note.
Right.
So that we could have it in your chart, because then it causes less hassle for the person that very much needs this care.
Right. So I always say, put yourself in their shoes, you know, they're depending on us to help them, and then they don't have service, they get upset. And especially if it keeps happening, and then it becomes embarrassing, and we really can't explain that.
I think something else happened recently with Sheila's hospitalization that nobody planned. I said to Ruth Termitu, I didn't know you were taking off 2 weeks. In other words, you and I check our schedules, we're
Right.
planning our visits, but I said what I would, now Pam, you'll remember from years ago, Elizabeth, Sharon, remember when you had to fill out the sheet?
Yes.
And you
I
had
think
to
we
turn
need to
it
go
in?
back to that.
Okay,
Yes.
Charmaine, and then the nursing supervisor had to sign it.
And we got a copy and we got a copy.
But you know now, everything is almost email for
Yeah.
most, so I
I
said
don't
to
either.
Ruth, no, okay. I said to Ruth, I would have really appreciated if you had CC'd me.
I think
So-
we need to go back to the old ways of doing things. I think we need to have some sort of written request if you don't have an email.
If you don't have the email.
Because there's some people that don't have email.
That's, yeah.
So, you
Yeah.
know, at any job I've
Yeah.
ever worked,
Yeah.
you had to write your request off. They didn't accept emails. You had to handwrite it, and it had to go through many hands. They usually gave you off, but they had to have documentation.
No, I
And
think-
there was none of this, you know, day before, I need 2 weeks off to go out of the country, you know.
Those slips are still
No,
in
they
our
still have the
Xerox
slip.
room
Yeah, they
upstairs.
still have the
Okay.
slip.
We can still
Okay.
They
get
still have
copies.
the slip,
And
yeah.
in your original handbook, you had a couple copies.
Right, well, according to
Didn't
this,
make
now this is right out of the handbook,
Yes,
you're
I will.
supposed to
Yeah.
make your
Okay.
requests within 2 weeks. We need at least 2 weeks' notice, but I think because of COVID, we're in the middle of a pandemic. We understand things happen, but we sort of really have to try to get ourselves back to that professional way of handling situations. So that's what the schedules and requests are. The schedules, again, are made a week in advance. So I think they have them done by Thursday for your following week. And I know some people that are new coming in have expressed, well, can't we get them ahead of time? I know I've personally worked places where your schedules were done up until 6 months in advance because they rotated you. You had nurses and aides that had a certain schedule every other weekend, so once you're hired, you knew your every other weekend, you knew your holidays, and you were responsible to find your coverage. And usually it worked out, believe it or not. But most places in home care now, you're only booked out for maybe a week, 2 weeks tops. I think only hospitals and nursing homes really are the ones that book you out way in advance. And they have to sort of do that because of just how they run their, you know, the site is run a little differently. So, that's that. You may not alter your daily work schedule, meaning if you have a client that is scheduled from, in particular the options program, their case managers come out and they ask them what times and what days do you want your service. So let's say they say I want it Mondays and Fridays 9 to 1. We put you on the schedule Mondays and Fridays 9 to 1. And then you have something come up and you can't show up till 1 o'clock. A lot of people lately have been calling the clients and changing the schedules, not even calling the schedulers. If your client is on an options program, we have to know ahead of time about a time change. Even they have to call us because they might have something come up and they're not home at 9. We have to know ahead of time because we have to get that over to the case manager. That's another policy and a procedure that we have, and they are told that at the time of their services with their case managers. So again, an options client cannot just do whatever they want to their schedule. Waiver programs, it's a little different. They're a little bit more relaxed, but not really, but they still have to have notice that things are changing. Now, another agency I worked at, what they would do to get out of this, they would give the client flex hours. So they would have 10 hours a day, flex hours, meaning they could pick whatever times they wanted in those 10 hours. That got to be a pain, but usually it worked out because then you had that little leverage. But unfortunately, you know, here you don't have that leverage, but people seem to not care. So you're just kind of doing whatever you want, and that has got to stop too. We're having a lot of aides just show up late, not even notify the office that they're running late. They just show up, and then some clients are okay with it, but most of them are not. You're supposed to be here at 12, it's 2:30, you know, I was waiting for an hour, and then we've had some clients recently who refused the aide at the door. And the aide get upset. It's like, you were running 2 hours late. You know, the client is expecting you at a certain time. You come 2 hours late without notice, and they're upset. So they have a right to be upset. So that's another thing that we kind of sort of have to patch up. If a client tells you before your shift ends, like 15, 20, 30 minutes prior, you have to call us. Like sometimes they want you to leave. I have a patient in Conshohocken. She doesn't like the aides to sit and look at her when they're done their tasks, so she does dismiss them. But she hasn't lately, because she got tired of calling here, saying, I'm allowing her to leave, but you have to call us. You know, unfortunately, we can't take your word for it, because there's a lot of people that flim-flam and don't tell the truth. If a client tells you, you can leave before your shift ends, you have to call us first before you clock out.
No, I dial the number and give them the phone.
Right, some of you guys are really good with that, but some of it we don't see until payroll day. Then Bonnie and Sheila are doing payroll, like, wait, she was scheduled for 4 hours, you only did 3.
Yeah.
So it's a whole bunch of stuff we really have to work on, because we have to also let the case manager know that this client allowed us to leave early, because sometimes the case managers might start to see a pattern with that client. Well, do you really need those 6 hours? It seems like you really only are using 4, and they do lose their hours. Same thing with waiver clients. If they're not using them, they will pull them. So that's another thing we have to keep in mind. So now I want to talk about Carewatch. Actually, before I talk about Carewatch, I want to talk about just briefly with the cell phones. This is becoming a major problem, and it's no longer subjected to just the younger generation or sitting down on their phones. I'm getting phone calls from people older than me that are just coming in and sitting down on cell phones and really doing nothing. That's a policy in our handbook, that the only time you're to be on your phone is if you're having an emergency call. I even have one aide, unfortunately, recently, in addition to the cell phones, bringing in a tablet to play games on. And I think a lot of people think because they're older population, they're naive to what's going on, they don't care. They pay attention to everything you're doing, and they get very offended when you come in and you're just sitting, especially when you're sitting on your cell phone.
Yeah, that's true.
Yeah, you're distracting yourself, you're not getting any of your care plan tasks done, so then that actually becomes a write-up. You know, you're not doing anything but sitting on your cell phone. So we kinda have to stop that too. That was one of the best and worst creations they've came out with, were cell phones. Way back when I started in home care, it was laptops. Laptops were kind of new, you had different sizes, you could kind of bring your laptop to work on your downtime. We know there's downtime, so people were getting in trouble on the laptops, but now it's the cell phones. Especially if you're on a case that's a long case. We understand there's going to be downtime, but you know, if we keep getting the same calls about the same people sitting on the cell phone, then it kind of becomes hard to defend you. Because now, especially if we're getting it from multiple different clients. If you're on a caseload and you have 3 or 4 clients and they're all calling in saying, you know, such and such just comes and sits, then it becomes very hard to defend you. Because there are some patients that fabricate, you know, you irritate them, then they're gonna call up and say, oh, Sharon, was on her phone all day. No, when she wasn't, but sometimes that happens, but if it's a pattern, then it's like, okay, we have to bring you in, we have to talk about this. So to avoid us having to bring you in, just put the phone away. Please, because I'm tired of the phone calls. I know Claudia is fed up with it. We shouldn't have to keep disciplining adults like this. I mean, we're all adults, we're all intelligent. We shouldn't have to keep reminding you guys of things that are right in your handbook. And this is no matter where you go, no matter where you work, there's always policies and procedures, and I know cell phones are a big one for most employers now. There's some employers that don't even let you bring your cell phones in. I know if you work at the prison, you can't bring your cell phone in. You have to leave it in your car. So, imagine that. If your family needs to get a hold of you, you have to give them the employee hotline number that they call if you have an emergency. So you're lucky you're in a place where you can bring your cell phone in, but please limit it, just turn it off. I think you turn yours off.
Nobody can get me on mine, this me.
No,
Okay.
I don't use the cell phone, no, I need it.
Okay.
Because,
I think one of your clients said she turns that right off and she gets to work. So I said, okay.
well, I work.
Right,
I work.
right.
No, I don't turn it off
Okay.
because VNA calls every now and
Right,
then.
that's true.
No,
So,
they never get me on my cell phone.
yeah, you're hard to get a hold of.
Yeah, they always
You too,
call the
Sharon.
client.
I think I've called you a couple times,
They always
and
call
it's
the
easier
client
just to
house.
call the client's house
Yeah,
to get a hold
so it's
of
like, troublemaker. Yeah, it's on silent and it's somewhere. As I go in, I put it down and I'm somewhere else.
you. Okay, so now let's talk about Carewatch, because this is the biggie. For some reason, people just are not feeling the way VNA conducts how you clock in or out. That's just how I take it. I think a lot of you think it's annoying to use the client's phone, which I can agree with, especially if the phone is corroded with stuff that you don't know what's on it.
No, sometimes you go in and as you go in, they talking to you.
Yeah,
so
that-
you get
we'll get to
distracted.
that.
With
We'll get to
mines,
that.
with mines, that's how a couple of them just, and I'm stalking, yapping.
Yeah, some of them
Yeah.
we know do yip yap.
So,
Okay, so,
Well, but then, wait, we can say, I'm on the phone.
Yeah.
I have to call you.
right, we'll get
That's
to
what
that
we
too.
have to
We'll get to
do.
that, because there are some clients that I think
Yeah.
purposely put themselves on the phones before you guys get there, but that's a story for another day. So, again, some places you work, you have to swipe a badge to clock in, you have to log yourself in on the computer. VNA, you have to clock in on the client's phone, landline, or cell. So we're having problems with this too. Upon hire, you guys are told this, you're told how VNA uses clocking in and out. I don't know how things were before this came. I heard it was with paper. Okay. So to combat fraud, they got rid of a lot of the paper documentation. So upon arrival, you need to clock in immediately. We do know things happen. Clients on the phone with the doctor, clients start yip-yapping. As soon as you walk in, they bombard you with stuff before you even get a chance to say, I need to clock in. We understand that happens, but we have to still clock in and out on their phone. You guys are supposed to be blocked, meaning you can't use your cell phones to clock in and out. But we do know you have to be unblocked for certain situations. This Carewatch has become very, very, very bizarre lately. I'm listening to the schedulers constantly lately on the phone with people, even seasoned aides, meaning people that have been here for a long time. Why didn't you clock in? You're holding up payroll. That just becomes a nightmare for them. It is what it is. VNA has the electronic verification system, so we know that you're there. And proof in case the client tries to say, she hasn't come in a week. No, she was there. She clocked in on your phone for the last 3 weeks. Because we know there have been situations where, there was a situation 2 years ago, where a couple in Norristown were trying to say that we hadn't shown up in months, and we had proof. It didn't go anywhere. They mentioned it to the case manager, and we looked through their chart and debunk that. So you got to be careful with that. So When you get to the house, please clock in as soon as possible. If you forget to clock in, or you can't clock in because there's a glitch, we've had 2 glitches I think in the last month now, please notify us immediately. Please don't wait until your shift is over, because they can't clock you in from upstairs.
No, we don't know.
Because I think a lot of people assume that the
No.
schedulers can clock you in. There are some people that say, well, can't you just clock me in? I was
No.
here at 9:15, she didn't get off the phone until 10, but you're not telling us this until 3 o'clock. So that obviously is like a red flag, especially if I get the same people that constantly have a story to go with why they didn't clock in or out. You cannot adjust your time
I don't.
without notifying the scheduler. We do know there are some people when you arrive, they're on the phone. So if you can't clock in, you have to let us know. There are situations at apartment complexes, you're supposed to be there at 9, you didn't get up there till 9:15 because they didn't hear the bell, or they forgot how to let you in. We had a situation a couple years ago where the client started mentally declining and she forgot how to let the aides in. So those situations we are very sympathetic to and we know, but if you're on a patient that there's really no reason why you can't clock in just because you really didn't feel like it, of course then we have to bring you in. Like I said, it becomes a nightmare for scheduling when they have to keep calling you and then you're holding up payroll because then you're holding up billing. So, tell you what, you guys have it very easy here with clocking in and out. My last job, there was a whole different department that handled punching in and out. Every patient, Verizon donated over 500 iPads to every patient. There was 300